my name's Sarah Simpson and I'm the Patient Pathways Manager at Brookside Group Practice, and I'm here with Dr. Sharma to talk to us a little bit more about eConsult. And we know that eConsult is something that our patients have been using more and more over the last 6 months, but as with anything new, there are always questions that crop up, and we wanted to just take a bit of time this morning just to go through some of those questions and find out more as to why eConsult's become so popular for GP practices generally. So what is eConsult and why introduce it now?
So eConsult is a structured online form, so lots of clinical symptoms and signs are on eConsult that you can fill in, all general advice forms. And what it enables you is to ask a series of structured questions which then allow us to receive information about the problem that you have, and so we can then better assess who and where is best to meet your care. It's a really safe form. It's been developed by clinical experts. It started in London and has actually spread throughout the country over many years, so it's been well tested and it's a well respected form and a way of providing care. The COVID pandemic's obviously accelerated how quickly we've used this. It was always part of the NHS's plan to use platforms like eConsult to help with your care, but actually the pandemic's meant that we've had to do that much faster and use it much more for our patients.
And why are we asking patients to use it? What are the patient benefits?
So for patients, it can be a really convenient way of managing your health. Instead of waiting on the phone or waiting outside the surgery and spending a lot of time doing those things, you can fill in a convenient form. On average it takes 6 or 7 minutes to fill in, so actually that's a real time saving. It can be really efficient. It's also a safe way of delivering care. Because of the way eConsult works, actually safety is absolutely paramount, and it means that you can trust when you use the service that it's being delivered in a safe way. It also means that you're having your care sent to the right person. It means that your care, if it needs to be prioritised urgently for that day, it can be more easily. We've got more information to enable us to make that decision. So it means that we're making more timely interventions on your behalf. Also, I would say, in terms of using eConsult, yes, there's a lot of benefits for patients, and I think one of the things is that actually for us as clinicians, we get that information, and that's really valuable. But we want to work in partnership with our patients, and one of the ways we can work in partnership with you is to really help us manage the demand that we're facing. COVID's also meant that the levels of consultations have gone up considerably. So actually we're delivering 25% more consultations now than we were pre-pandemic. And that's across the board of face-to-face, telephone appointments, online type consulting as well. So in order to help us manage that, we really want to empower our patients to provide more care for themselves where that's the most appropriate thing. And eConsult has that built in. So what you'll see on all the clinical templates is a self-care facility, which you can click on to see what it is for that condition that you could do yourself if you haven't done those things already. The community pharmacy is another option, and we're working closely with our community pharmacists, so we will be sending some of the eConsults to community pharmacy, and they'll be the people actually to contact you if that's the most appropriate place for your care. There's also nhs.uk, so www.nhs.uk, where you can put in any condition, any symptom, and it will advise you on the different courses of action that you could take. And that may be a useful first step when deciding where to seek the most appropriate help. Of course, if it is the GP practice, and often we understand it will be the GP practice, then using eConsult is the most convenient and best way for you to access that support you need.
So the way it's helped, well, one way it's helped is it's really speeded up the consultation, so patients are having to wait a lot less because we're keeping to time. A lot of the information is just there, it's on the screen, we don't have to ask it all again. The other big thing is that if we need tests or ECGs before we see them, they don't have a wasted appointment. You know, we can see what's needed up ahead, we can get them organised or send a text saying please organise this. They come in, we've got the tests, and we can do the referral or move on or do what's needed. So it's been good.
So many different benefits of using eConsult. The main benefit is that you can access the platform from anywhere, from any device. The NHS app is even quicker to use because it pre-populates your information. And this also breaks down the barriers to accessing healthcare for some of our patients, for example with mental health illnesses.
As a member of the Health and Wellbeing team, we're here to support our patients with emotional and practical difficulties. Our team is skilled in listening and helping direct patients to the best support available to them. The eConsult will enable us to have a lot of information right up front and access that support more efficiently.
So it's definitely ease of access, because you can complete that form when you normally would have been in a queue on the telephone to get through to our patient services team. You get an acknowledgement from the eConsult service to tell you you've submitted it, and you know that we're going to look at that by the end of the next working day. And then when we get back to you, we're going to tell you who the person is that's going to be dealing with that for you, and that should be the right person first time round to save you time.
So when an eConsult is filled in by a patient, how quickly will they get the help they need?
So eConsults typically will be looked at, and then you'll receive a response by the end of the next working day. So you'll get a phone call or a text as a response, as an acknowledgement that the eConsult's been received, or as a call or a text to deal with the problem that you've come in for. The eConsults are actually triaged by clinicians and by patient services team to decide on the best time frame for the appointment. So if it's a week or 10 days, you can trust that it's appropriate for the appointment to wait that long. Now, sometimes that will mean that actually you're responded to, but actually the appointment to deal with the problem is actually a week or 10 days further away.
There are lots of questions on the form. Why is it so long?
Yeah, good question. Yeah, so there's lots of questions, primarily because, as we said earlier, eConsult's all about patient safety. When you have a consultation, obviously we ask a lot of questions as well, and this is about trying to get all of that information. So it's there, it's safe, eConsult can make a safe decision about your care, whether it is appropriate for the GP practice or it's more appropriate for elsewhere. And also for us as clinicians, it's great to get all that information coming across from eConsult. So it's really important you do fill in the form, and as much as you can. The first few sections of the form actually allow you to put in more free text, and it means that you've got greater opportunity to actually really write the things that you've been experiencing. Sometimes we find patients tell us after a face-to-face appointment or a telephone appointment, oh, I wish I just remembered that one piece of information that I wanted to share. And this gives you a bit more time at home to be able to do that and provide us with that information.
And what about for patients who feel that they really want to see a GP face-to-face for an appointment? What happens then?
Yeah, so first thing to say is we are seeing patients face-to-face every day, all the clinicians are, and we're using face-to-face as well as telephone and other ways of seeing patients, so that is happening. Now, of course, previously we used to do far more face-to-face appointments pre-pandemic, but we've always done telephone consultations. For 10, 15 years plus we've done telephone consultations. But face-to-face was more, absolutely. Now, one of the reasons we can't have so many face-to-face appointments is because of the PPE that we have to wear when we see patients. Those who've been to the surgery will have seen that. The decontamination we have to do after every patient leaves still. So whilst things are opening up in society, actually we're still having to do those measures. We also have social distancing, which means we can't have many people in the waiting room. So having long clinics full of face-to-face patients isn't actually achievable at the moment, and that's something NHS England have also encouraged us not to do at the current time. That said, I think the way we've found we can use eConsult and telephone appointments, which we've always had, means that going forward we're likely to have a blend of face-to-face, telephone, online and other forms of consultation as we go forward. So our patients have got more variety in their options and the way they access healthcare. I think the other really important part to your question there, Sarah, was about GP appointments, because you mentioned the GP bit, but actually that's not acknowledging the wide range of staff that we have. Perhaps in a time gone by, 15 or 20 years ago, all the care here would have been provided by GPs or nurses. Well, that's certainly no longer the case in 2021. We have such a wide team who actually have got so many specialist skills that they bring and are able to help patients in a different way, and I think the service we now provide is better for it. So we have paramedics, we have specialists in musculoskeletal medicine, we have pharmacists or a pharmacy technician, physicians, associates, healthcare assistants, And all of those members of staff are really adding to the offer that we have for patients. We also now have a health and wellbeing team who actually are focused on empowering patients and helping patients with self-care and other problems that they have in the wider aspect of their life. So the offer we're providing now is much broader than it has been in the past. So I think it's important that we remember that when you're given an appointment perhaps to see somebody who isn't a GP, actually it's because they are trained and they have the appropriate skills to actually provide the care that you need. Also, our professionals do work closely with GPs as well. So where extra support or advice is needed, they will get that.
So what about those patients who actually can't use eConsult for one reason or another?
Yeah, absolutely. So we totally understand there are some people who won't be able to use eConsult. I would start by saying, knowing our population as we do, the vast majority of patients we think can use eConsult. If you've got a smartphone, you can use eConsult. It works very well on the phone, and our data on our population is that we're actually younger than the average population for a GP surgery. So the majority of our patients we know should be able to use eConsult. And that's really, really important, because if the majority of patients are using eConsult and not ringing up, actually it means the phone lines are more free and available for those who genuinely can't use eConsult. Because particularly those elderly, vulnerable patients who aren't able to access eConsult but actually have a high level of healthcare need, it's really important that the phone lines are open for them. Or patients with learning disabilities, or perhaps patients who are blind, actually having the phone lines more available, so our patient services team can actually spend that time really tackling the problem that they have and getting that information and getting it to clinicians in a prompt way. That would really help, I think, manage everyone's health better.
And can patients complete an eConsult for somebody else in that case? So say it was a patient who couldn't use it directly themselves, can somebody else do it for them?
Yeah, in the main, we'd encourage people to use eConsult for themselves and not to use it for other patients. But actually, we understand there's some exceptions to that. So if you're a parent, for instance, you will be filling in an eConsult often for a child if you've got a child who's under 16. But actually, there's other situations like carers, for instance, of a dementia patient perhaps, and maybe an example where actually you would fill in an eConsult on behalf of the person you're caring for. It's really important though that if you do that, that you put clearly in the form who you are and your relationship to the patient, and also make sure we have the correct phone number so that we can contact you back with any correspondence that we need from that consultation.
And can our patients submit more than one form about the same issue or about related issues?
So ideally, we'd like you not to complete multiple forms. If you have a problem which is in addition to the template that you've got in front of you, then by all means include it within that one form. I think it's far easier for us to manage when we're looking at it as one form, because we understand that ideally, yes, you'll have one problem, but sometimes there can be a couple of issues. We used to experience that before as well. So yes, just I think put it on one form ideally to be able to give that information.
What if eConsult tells a patient to stop what they're doing while they're filling in the form and they're to do something else, like contact the practice or ring 999 or 111?
Yeah, we know that absolutely happens. So again, it's because eConsult is clinically safe. At times, if you put in certain things, it will stop you filling in the form and actually suggest that you either call 111, 999 or contact the practice. Now, it's important to remember, if that happens, it's because there's something that's been put in that's considered potentially unsafe and needs more urgent actioning. Also, if you ring 999, 111 or the practice, actually none of us will have that information. That's part of the way eConsult works. So we just need to bear that in mind and remember that. If it's a problem that needs 999, then obviously call 999. If it's a 111 or contact the practice, you've got two options there, and 111 is a port of call that you can use if you'd like to actually help triage the issue that you have. Sometimes when that comes up on the form, actually it's because of certain things you've inputted, like pain levels. Now, for some of the forms, the pain levels trigger that form, trigger that notice to come up. For others, it doesn't. So I think just consider as you're going through the responses that you've put in, are they is that the most appropriate response, or have you clicked the wrong thing? Because occasionally we found patients have actually just pressed the wrong thing, and that's triggered that response, when actually the matter was a more routine matter. So just double check that as well before contacting the practice.
And how does the practice actually benefit having eConsult as part of its service?
Yeah, well, for the practice there's a number of benefits, some of which we've already mentioned. So the biggest benefit really is to have the clinical information. For me as a clinician, to have all that to hand enables me to make faster decisions and better decisions, more well-informed decisions. It also means that we're able to take on probably more in terms of consultations, more patients in a day than we would have done in the past. And that's certainly something that's been really helpful because the demand levels are so high at the moment. I think also what it does is it gets some of the pressure off the phone lines, and that's why we're really keen for patients to actually access online e-consults rather than the phone where they can, because it means the phones are more free for those patients who need that care the most. And that's something we're passionate about. We want to make sure everyone in our society has an equal opportunity to access the services that we have. And I think what it also does, it helps us to triage the work most appropriately, make best use of the allied health professional workforce that we have, and to make the best use of everyone's time and resources. And that's really important so that we can continue to provide a really good level of care. So I think it's really important that we do engage with eConsult. It will help with the practice managing of the workload, and actually ultimately helping patients helping patients to have the best level of care that they can, to enable us to deliver the right care by the right person at the right time.